Hi, everyone. I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. I'd like to discuss today the difference between social and physical dysphoria and how they can and often do overlap. There is a significant difference between the two, and both of them stem from different things, and both of them tend to contribute to dysphoria. There's also tends to be demographically starting to be a shift in terms of which individuals experience which. So I just wanted to point out on all of that. So if you are older and you're watching this will help you understand aspects of why you're experiencing physical and social dysphoria. And if you're younger, especially for younger adults that I work with, again, I only work with adults, but younger adults that I would say age 18, maybe age to 28. I always quote that age group. There's a reason for that. I see much more social dysphoria, and I'll explain how that ends up manifesting in the physical dysphoria and how it tends to affect your potential decision on whether you would like to move forward with surgical or even medical transition. So let's unpack first what is social and what is physical dysphoria. I'm going to start with the physical dysphoria. Physical dysphoria is, simply put, dysphoria, discomfort that you feel in relationship to your physicality, in relationship to your body, in relationship to your body parts. A lot of individuals who identify as transgender binary folks, meaning you strongly identify going from a gender assigned at birth to the complete opposite end of a spectrum of the gender. So if you were male assigned at birth, you really strongly identify with a strong feminine. If you're female assigned at birth, you strongly identify with strong masculine. A lot of individuals who especially identify as transgender binary tend to be individuals who experience a lot of physical dysphoria. Why? Because secondary sex characteristics that all of us experience as a result of puberty do affect how our body tends to evolve. The hormones that spike up at puberty, whether it is estrogen or whether it is testosterone, affects how our bodies evolve and in what form or shape our bodies end up shaping up. And for individuals for whom the origin of their dysphoria is physical, there's going to be an element of severe discomfort or discomfort in general in relationship to body. So classic example for individuals who feel discomfort with their chest, because it denotes to them and to society a gender they're not comfortable with. Classic example is for people to feel discomfort, dysphoria with their genitals, because it denotes, again, to them and to society, genders that you're not comfortable with. The tone of voice, facial hair or lack of facial hair. So we're talking about stereotypically very binary gender characteristics that we culturally have come to know as male and female. So it stems from physical discomfort of physicality. Here's the thing about physical sense of dysphoria. Physical sense of dysphoria, usually for a lot of people who are older, has an early onset, meaning you were aware of this physical sense of discomfort with your body early on. Not for everybody, but for a lot of you, the awareness has been early on. The awareness can also really kick in during puberty. But again, the secondary sex characteristics tend to come to the forefront and to start really changing your body. What you need to understand about physical dysphoria is that it's inevitable to have physical dysphoria without then experiencing social aspects of dysphoria. Physical dysphoria goes hand in hand with social dysphoria. Whereas I'll explain later, social dysphoria doesn't necessarily always go hand in hand with physical dysphoria, but can lead to physical dysphoria. So let me clarify. For those of you who experience and continue to experience physical dysphoria, you know that it's inevitable for you to develop social dysphoria. What do I mean by that? So what is social dysphoria? First, physical dysphoria is your own discomfort in relationship to your body. Social dysphoria is everything socially, how society sees you, how other folks see you, how people interact with you, how people gender you, how socially you're navigating the world, whether you're comfortable navigating your world through this gender or not. So think about all of the things social. So you can see now how when you have physical dysphoria, it's impossible not to have social dysphoria because your presence and existence is rooted in this world, also in relationship and in proximity to social interactions. Unless you're living off the grid, which, by the way, somebody asked me this question. I think it's a fascinating thing to ponder. If somebody existed off the grid where there are no other humans and they had no constructs or conceptions of gender, would they still struggle with gender dysphoria? And that's $1 million question. I say that some folks will still, because there's still an innate kind of knowing about your relationship to your gender. So the reality is that a lot of you don't exist on an island. You're not living off the grid. You interact with other human beings, whether it is your families, your friends, your coworkers. You have to get up, you have to go to work, you have to go do grocery shopping. In other words, day to day, you're bombarded by being in a context and proximity to other human beings. And because of that proximity, those beings, those other human beings also interact with you based on their perception of your gender. And again, unless people directly ask what your gender is, right? There's no way of knowing. So they will go off assuming, and the assumptions are going to be based off, majority of the times, based on binary systems. So when you have physical dysphoria, it's inevitable to develop social dysphoria because you're already feeling discomfort about your body. Let's say you are female assigned at birth and you don't identify with gender at all. You identify with the masculine gender expression, gender identity, and you have a lot of discomfort about your chest. And you have that physical dysphoria. Now, every time you go out there and every time you present and people look at your chest and people may be automatically gendering you as a female based on the stereotypes of women having breasts, that's going to start giving you even more dysphoria. So your physical dysphoria is going to spike up as a result of those interactions. And as a result of those interactions, now not only do you have dysphoria in privacy relationship to your body, but now you're going to develop dysphoria in relationship to society, to social interaction. So your social anxiety going to go up, your social dysphoria going to go up. So those of you who have physical dysphoria, and a lot of you do by far, social dysphoria, you know already, I'm preaching to the choir, you know that social dysphoria is inevitable. There's going to be a lot of social elements that's going to give you lots of dysphoria. This is why I often say that social transition is by far the most difficult one because of all of the things. It tends to really spike up and increase physical dysphoria, and it tends to also spike up and increase your social anxiety, which tends to be married and go hand in hand with dysphoria. Now, let's get back to social dysphoria. What is social dysphoria then, right? Could there be people that have no physical dysphoria but only have social dysphoria? The answer is yes. Absolutely, you exist, you're out there. In my experience, what I'm starting to witness in my practice is that a lot of younger adults, again, age 18 to 28, I'm seeing a lot of younger adults who are coming to see me who are expressing this. This is the narratives that I'm starting to hear. I feel neutral about my body. I feel neutral. I'm not even gendering my body. I feel neutral. My body is okay. I don't really mind particular gender specific parts of my body. I feel comfortable with my body. But what I am feeling is I'm not comfortable with, I'm still not in touch, in alignment with my true gender, and I'm not comfortable also how the world sees me. And I'm not comfortable also how the world genders me. So the world, it's more social because I might be okay with my chest, right? Again, going to that example, I might be okay with my chest, but I'm having a lot of social dysphoria because every time I go out there, I'm being gendered as female and I'm not comfortable. I don't identify as female. A lot of individuals who express to me a lot of social dysphoria tend to have less of a binary gender spectrum identities. It's much more non-binary, genderqueer, gender nonconforming, a lot of other elements and expressions of gender, but it is less likely to be a gender binary expression. It could be, but in my experience, I'm finding it's less so. And because you are individuals who have much more maybe fluidity or much more maybe a different relationship with your gender. And I think a lot of you are having different relationship with your gender because you're younger. So you are fortunate enough to not only grow up in a little bit more advanced times, I would say, but you also like it to live right now where we are having all of these people talking and expressing gender and the understanding of gender and language in relationship to gender shifting. So that's why it makes complete sense that a lot of you are having less body dysphoria, less physical dysphoria, and you're having more social dysphoria, especially if you have a more fluid gender identity, or especially if you have non-binary gender identity, and you're comfortable with your body, but if you're not comfortable with how the world genders and sees your body. So that's social dysphoria. And I see that much more again with younger adults. And this is where it becomes a little bit more challenging, right? Because if you think about it, if you have physical dysphoria to start off, which then inevitably, like I said, sweeps inevitably gets into social dysphoria, then for you as adults, you already know you strongly belong, chances are, to a particular binary, and you already know that your goal is already to align your body physically as much as possible as you can congruently to your gender. So for a lot of you, medical and surgical is something that you're considering, and if you have resources, you go for it. For younger generation, or even if you're older and this is happening to you, because I don't want to rule out that it won't happen to older individuals, it's just so happening that I see this pattern-wise in younger adults. For younger generation who becoming much more in touch with their gender, it starts off as social. Again, it doesn't mean that it can't start off as physical, and with a lot, it definitely starts off with the physical too. If it starts out for you as a social dysphoria, the challenging part is then people start to develop physical dysphoria. Not all of you, but sometimes you do. And the reason why you develop physical dysphoria is because if you're comfortable with your chest, and you feel neutral about your chest, but your gender identity is not female assigned at birth, but your gender identity is non-binary, for example, and every time you go out there, you're being gendered female, 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 woman, 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 again and again and again and again, and that's not your gender identity, eventually you're going to start putting those little patterns together, and you're going to start analyzing why that's happening, and you're going to start to perhaps even realize, oh, I'm being gendered as female because of my chest. Socially, they're boxing me into this binary because of this. And for some people, that will lead to developing now physical dysphoria in relationship to chest. Okay? And that's when people decide to pursue other elements of gender transition, surgical, to remove their chest. So this is where it becomes a little bit tricky, because if you truly feel comfortable with your body, but then you develop physical dysphoria, the question is, can there be anything that you can work on to dismantle the dysphoria, or is the surgery becomes the only way? And that's $1 million question, and that's a question that's very personal and very personalized. Some people develop physical dysphoria that just stays there with them for a long periods of time, where a surgical option is inevitable. And some people, it's just a matter of, oh my God, I'm trying to see how to phrase it, because here's the thing though, the challenging part is that if you have physical dysphoria and it's just a matter of accepting that socially the society is just boxing you, well, it's still you still continue living with dysphoria. So you're still suffering and you're still in pain. So it's $1 million question. But I have been seeing a few individuals who are young adults who have a lot of social dysphoria, who haven't really developed physical dysphoria yet. I hope they will never develop physical dysphoria. having social dysphoria in of itself alone is enough, who already thinking about surgery to modify some of their secondary sex characteristics. So for me personally, as a professional with those individuals, the question is, well, why? If you're telling me you're really neutral and okay with your body and you don't have any physical dysphoria, why are we even going there? So that's my only 2 cents, is that if you're in a camp where you have social dysphoria only, you haven't developed physical dysphoria yet, maybe you'll never develop it. My question to you is just sit with it a little bit longer. What is the surgery going to give you? What is the surgery going to solve? Surgeries, medical transition, hormones, even social transition, all of those things are there as some viable solutions to solve a problem. The problem is dysphoria. The viable solution to alleviate dysphoria, right? And again, it's a very valid question. Well, why can't surgeries be there to solve problem of social dysphoria only, without needing to have a problem with physical dysphoria? And I don't have all of the answers. I don't know. I can only guide individuals I work with as best as I can and help them, especially since I work with adults, to really ask themselves all these complicated and difficult questions and to give themselves time to really think and sit with those things. But at least in individual cases. But that's where it becomes a little bit trickier with this population we work with today, that are fortunate enough to live and exist in a world where they have all of this understanding and language to talk about gender and to understand their gender. I really wish we lived in a society where human beings that just completely moved away from gendering and the concepts of gender, where it just was, you look at another person and it's a person. It's a person that has their own variables, their own distinct characteristics. It's a person that, I mean, like you would look at me and you would think, oh, this is a person that wears red lipstick and bold glasses and they prefer to wear black all the time, versus, oh, that's a woman, or that's a non-binary person, or that's a transgender person, or that's, I don't really understand. I mean, I do understand, of course, on a deeper level, but gendering human beings in terms of an individual cases doesn't really get us very far, because it's not really a necessity. So it becomes a little bit challenging when there's social dysphoria as the outset, because then, of course, it can also become physical dysphoria. And I see that much more with people who are not necessarily within those binaries. Another very viable and very important question is, why not have transition or go through transition simply because of euphoria alone without dysphoria? And that also another topic and completely another discussion for a different video. For this video, I wanted to discuss with you what's the difference between physical and social dysphoria. I've been speaking a lot lately about social dysphoria in younger adults. I've been speaking a lot lately about how if you truly feel neutral and comfortable with your body, and you're thinking about surgery, just not that you shouldn't have surgery. You guys all know me. I'm definitely not a gatekeeper, but I'm also not overly affirming. I'm a discerning provider. So if you truly feel comfortable, and I had an appointment with somebody who said they're very comfortable with their chest and they love their chest, but they hate how their chest gets gendered constantly. So my question is there something that can be worked on without you having to give up your love and your relationship to your body and to your chest because of goddamn society? So just something to think about there. But definitely, if you have physical dysphoria, social dysphoria, in my experience, inevitably going to be there. They're two married. I don't think you can separate them too. But it is possible to have social dysphoria without any physical dysphoria. In the end of the day, we're still talking about dysphoria. We're still talking about pain. We're still talking about discomfort. We're still talking about disalignment. We're still talking about people not feeling comfortable and congruent with their gender identities. So the discussion is still revolving around the same theme. So comment below, let me know whether you are, what's your experience with this too like? Was you onset started off with physical dysphoria? I would bet that most of you who identify as trans-binary would say it was physical, that you always had a dysphoria in relationship to your body, and social, of course, is very inevitable. Like I said, they're married together. So comment below, let me know. For those of you who are younger adults and watching, and if you only feel social dysphoria, share below what are your thoughts. Do you feel like you're starting to develop physical dysphoria? I hope you're not. If you are, what are your plans? What are you thinking about doing it? If you are somebody who only has social dysphoria, what is that experience like for you? So share below, comment, let me know. I'd love to read all of your comments, and I'll see you all next time. Bye.